Imagine a young boy named John Wilson. In many ways, John is just like any other 8-year-old boy. He loves trains, airplanes, and riding his bicycle. However, John was diagnosed with leukemia at the age of 6. Since that time, John has been admitted to the hospital on numerous occasions. The hospital stays are hard for John, and they come sporadically. Although John's mom packed all his favorite trains, airplanes, and everything she could to make him more comfortable, John is still very nervous about having to stay in the hospital. Every time that John is admitted, his parents realize just how scared and worried their son is becoming. John's parents mention to his nurse how hard this day was going to be for him. It is then that the plan to introduce John to one of his best friends begins. One of the greatest bonds of all time is the bond between dogs and man. Documented therapy dogs are dated back as far as ancient Greece. These dogs were used to comfort the ill and often accompanied important rulers on military campaigns and long trips. Not until the 17th century in France did the use of therapy dogs become popular. The dogs were used on the battlefield to comfort and reduce stress on the wounded. These dogs provided comfort and companionship to everyone they encountered. In the 1800s in Belgium, Florence Nightingale, who is famous for her key research in the development of modern nursing, discovered that small pets, such as dogs, lowered stress levels in psychiatric patients. Florence Nightingale's observations led to the first formal research into the use of therapy dogs. The first documented therapy dogs in the United States was used in World War II. She was an abandoned Yorkshire Terrier found in a foxhole. Smokey was placed in the 233rd Station Hospital. There she would make rounds visiting all the wounded. She became the first therapy dog with a documented case of reduced stress on a wounded soldier. Smokey would lie next to a soldier in recovery, helping him recover physically as well as providing calm rest. In the 1960s, the first formal research of therapy dogs began in the United States. Dr. Boris Livingston, a child psychotherapist, found that his dog, Jingles, had a positive effect on his patients. When Jingles was in the room, Dr. Livingston noticed that children who did not like to speak had an easier time communicating. He noted that these patients were calmer and more comfortable when they were around another human. Dr. Livingston established himself as the father of animal-assisted therapy. Therapy dogs are now used in hospitals, nursing homes, and even airports. The use of therapy dogs became popular in the United States in the 1960s. Therapy dogs have become a significant part in the healing process of many individuals. They are used to comfort patients in time of stress and recovery in hospitals, airports, and nursing homes. The most popular breed used in animal therapy is the Golden Retriever. Golden Retrievers are known for being very outgoing and always full of energy. The definition of a therapy dog is a dog specifically trained to provide affection and comfort people in hospitals, retirement homes, nursing homes, schools, and people with learning difficulties. Therapy is defined as the treatment of a disease or disorder by some remedial, rehabilitating, or curative process. The usage of therapy dogs is very beneficial to people with a variety of needs, and they should be employed and accommodated more widely in all settings. Therapy dogs provide numerous benefits in the medical field and in everyday life. Finally, God gave man dominion over animals. Therefore, man should utilize them in many ways, in both the healing process and ultimately for the glory of God. Therapy dogs provide numerous benefits and uses in the medical field. Hospitals are often very high stress and unhappy environments. In hospitals, patients tend to feel very lonely and isolated. Although the hospital staff interacts with patients, their physical touch is not the same as the touch of a loved one. According to Terry Astrino, a nursing professor at the University of Edinburgh, therapy dogs provide a joy like no other during a hardship. Therapy dogs have been proven to reduce stress up to 50% in hospital rooms. Kathy Davis, a well-known author and trainer of therapy dogs, recognizes this in her writings, saying, "Another way therapy dogs help people is by meeting the universal need for physical touch. This need is not satisfied by the neutral touching involved in physical care. Interaction with the therapy dog not only provides companionship, but also tangible contact with another living thing. Children in hospital situations are often very uncomfortable. These dogs create a happy distraction and provide joy for them. In today's medical field, there is no substitute for a loyal and loving therapy dog. Every day spent in a hospital room creates an opportunity for the feeling of loneliness and helplessness. Therapy dogs help people overcome depression and aid in a faster recovery. Nico, a young boy who lost his leg, was helped by a therapy dog named Hathaway in a way that no doctor or nurse could. Nico refused to talk to the medical staff or allow them to touch him. Once the bond with Hathaway was created, Nico cooperated and began his road to recovery. The benefits of therapy dogs are not only limited to recovering hospital patients. Since the terrorist attack on September 11, 2001, therapy dogs have been placed in airports. In 2018, there were over 58 programs that provide therapy dogs in airports. These dogs are used to comfort those who are fearful of flying. Therapy dogs are also used to allow travelers to decompress after missing a flight or having a flight canceled. Even just a few minutes interacting with a therapy dog, stress levels have been proven to be reduced and endorphins are released in the brain. Often, airports will request the dogs during a stressful period, such as a flight delay or airport shutdown. Therapy dogs are also used in nursing homes with patients with dementia or Alzheimer's. Patients that receive therapy dogs have seen improvements in levels of depression and loneliness. They also help those who struggle with frustration over their situations or lack of ability to communicate effectively. Therapy dogs intuitively read body language of those in their care. As a resident becomes anxious or upset, therapy dogs can comfort or soothe them. Silverado Senior Living, a company that operates assisted living, hospice, and home health services, encourages residents to have a therapy dog. The owners have seen that having a therapy dog helps the residents feel more at home. The pets also provide a distraction and a purpose beyond themselves. Humans have a natural desire to nurture another living thing. One resident recovering from a broken hip was not cooperating with his recovery plan. Jan Vincent, director of the Animal Health Foundation of California, brought a therapy dog to the rehabilitation center. Jan helped this man's recovery by asking him to walk the foundation's dog. All of a sudden, he had a purpose beyond his own therapy, and this change in focus and gentle distraction helped him recover sooner. The therapy dog created a purpose for something other than himself and helped motivate him to complete his therapy as well as stay active. Secondly, therapy dogs are trained specifically to act appropriately in all situations in order to avoid potential problems. The choice of which dog to train is very intentional, and the decision process is deliberate. According to Susan Warble, a noted author and therapy dog trainer, before any dog may receive training, reassurance is provided that the dogs do not show signs of xenophobia, which is the fear of strangers. Therapy dogs must interact with everyone that they encounter in public or private situations. Dogs could be aiding an individual in a hospital or be placed in a busy area such as an airport. The dog must be able to handle both situations well. It has been proven that therapy dogs are extremely beneficial with children. Therefore, the dogs must be comfortable around children. Often children grab and pull on them, and they must not interact to this type of interaction, and they must remain calm and collected. Therapy dogs must not be distracted by other dogs. The dogs must obey all commands and not be startled if a crowd gathers around the dog. Therapy dogs must not exhibit any signs of aggression in order to be put into use. Therapy dogs are trained by being taken out into public to interact with people and learn to obey commands. These dogs are exposed to a variety of situations to ensure that no problems will arise. If any dog shows aggression, such as growling, towards another dog or patient, the dog will not be used as a therapy dog. Not just any dog can be used as a therapy dog. Therapy dog training must begin when the dog is between 1 and 2 years old. Therapy dogs receive 120 plus hours of training. The 120 hours includes training in public settings as under many circumstances. The more hours of training a therapy dog receives, the better. Therapy dogs must also be able to obey commands, walk without a leash, and not jump on people. Therapy dogs cannot be distracted by smells or curiosity about a new environment. Another component of training is separation training. In this training, the dog must be able to follow commands given by people other than its owner. Training for a therapy dog may take upwards of 2 years, depending on the dog and how it reacts to human contact. Every dog is different. Some dogs may take less time than others to train. Finally, God gave man dominion over animals. Therefore, Christians should utilize them in many ways, in both the healing process and ultimately for the glory of God. Genesis 1:26 states, "Then God said, 'Let us make mankind in our image, in our likeness, so that they may rule over the fish in the sea and the birds of the sky, over the livestock and all the wild animals, and over all the creatures that move along the ground.'" This scripture clearly defines man's dominion over animals. It is man's responsibility to care for and manage all the animals on the earth. The use of a therapy dog not only puts his creation to use in a beneficial way, but also benefits man. God created dogs and mans, and he saw that they were both very good. Under this scripture, there is no question that animals are under the dominion of man and can therefore be used for man's benefit, such as when we use them as therapy dogs. But humans are not using animals to their maximum benefit. Man should be good stewards of the world. God left man in charge of the world and over animals. Numerous cases have doctors amazed by the bond created between a patient and his therapy dog. Therefore, if man uses a dog for therapy, it is utilizing a gift for God. God created dogs for man, yet many people are unaware of the many benefits therapy dogs can provide. Most dogs in hospitals are placed by privately run companies. The private companies that are currently in place need to expand. In order for expansion to happen, more funding is needed from private donations. Education to the public in the use and benefits of therapy dogs is greatly lacking. If more people were educated on the benefits of therapy dogs, the greater the chance would be of more money being donated. Benefits to donors include not only the goodwill of placing dogs, but also tax breaks for the private donations. These donations would then allow these companies to grow and place more dogs in more hospitals. Some people might assume that because therapy dogs are in hospitals, personal dogs should also be allowed. This might seem like a reasonable assumption. However, therapy dogs undergo numerous hours of training. Personal dogs are unpredictable in their behavior. Therefore, only trained therapy dogs can be allowed in hospitals. God has given animals to us as a good gift. They are here to help us. Therefore, if therapy dogs have been proven to be helpful in many situations in numerous locations, why would we not support their use? Therapy dogs have proven medical and emotional benefits. We should all consider supporting companies and organizations that place therapy dogs in each of these public locations to honor God's gift to us in animals and to promote the healing of our neighbors. Remember John Wilson, the child who was undergoing chemotherapy. The second day of John's hospital stay, John met Roscoe. Roscoe was a full-blooded golden retriever, one of the therapy dogs brought into the hospital to help with patients. Immediately, John's face lit up, and within a few minutes, John's entire mood shifted. Every day after, Roscoe spent time with John while he was in the hospital. John was happy and excited to have Roscoe. John's parents noticed that the overall nervousness and heaviness in John was not present while Roscoe was in the room. Even today, after the chemotherapy has been completed, John's parents absolutely believe that Roscoe was a major part in the healing of their son. Thank you.
Thank you, Braden. Do you believe that the U.S. government or taxpayers should fund therapy dog training?
I think that the government should play a role in that. I don't think it should be something that they set aside tax money to because that money should go to more necessary things such as medical equipment that would be used in a hospital, and money should be donated to organizations instead that place these dogs and train them.
I don't like to fly. Where would you find the therapy dogs in an airport?
Can you repeat the question?
Yes. I don't like to fly. Where do you find a therapy dog in an airport?
In an airport, they would be in the terminals after you had gotten through security.
What's the difference between an emotional support dog and a therapy dog?
Therapy dogs undergo training, and they are actually certified by the National Therapy Dog Association, while a emotional support dog is something that anybody could label their dog as without training.
Do therapy dogs cause problems with children in hospitals who have allergies?
If a child does have an allergy, that would be something that a doctor would note, and therapy dogs are only placed in specific locations and certain floors of the hospital, so if a child did have an allergy, it would be put on an entirely different floor.
Is there a certain breed of dog that does better as a therapy dog?
Golden retrievers are the main ones because they're a fairly large dog. Smaller dogs can be used, but certain problems could arise with a smaller dog, so a bigger dog that has lots of energy would be a better fit for certain times, I guess.
Have you ever experienced any of these benefits from your own dog?
From my own dog, I guess you would say yes. It's coming home from school after a long day, so I have seen emotional benefits from that.
Do therapy dogs ever create separation anxiety for patients when the dogs have to leave?
That is a problem that I did see, but that is something that is a problem, and there's not really currently a way to deal with that. I see that if a child did have a really strong connection, the family could just keep in contact with the organization and maybe visit the dog after their hospital stay or wherever they met the dog.
Are there situations in which a therapy dog would not be recommended?
Situations, I guess, would be places where there's really not enough room for a dog, or the location prohibited a dog. So I think those would be some.
Thank you, Braden.